Everyone. We will be just beginning in about 2-3 minutes. We are just waiting for an update from our chief guest, Honorable Health Minister T.S. Singh DO. So just give us 2 minutes and we should begin shortly. Thank you so much. Good afternoon. So we will begin our event. There is a slight delay from our from the Honorable Chief Health Minister of Chhattisgarh. So without much further ado, we will begin with our keynote address. So I'll just like to introduce everyone first. Very good afternoon to everyone, and we welcome you to this interactive session on WASH matters now more than ever, prioritizing hygiene for building resilient health systems and communities, organized by USAID-NISHTHA in partnership with Unilever. NISHTHA is USAID's flagship health system strengthening project implemented by JPIGO, where we aim to transform, redesign, and re-engineer primary healthcare in India to meet the goals of provisioning equitable, comprehensive, and client-centered primary healthcare for India's marginalized and vulnerable populations. USAID-NISHTHA, in partnership with Unilever, is expanding the reach and impact of healthy hygiene behaviors among communities across India for improved health and well-being. Safely managed WASH services are an essential part of preventive healthcare and even more crucial for human health during infectious disease outbreaks, especially beyond COVID-19 pandemic. There is a need to position WASH as one of the most cost-effective strategies for resilient health systems and prioritize investments in WASH, which have never been so critical given the COVID-19 pandemic. USAID, in view of this, we are organizing today's event on WASH matters now more than ever, prioritizing hygiene for building resilient health systems and communities. Without much further ado, I'd like to invite our first speaker, Dr. Jayanti Ravi, who's a secretary of Auroville Foundation and the former principal secretary for Health Gujarat. A scientist, a civil servant, performing vocalist, administrator, thinker, and widely traveled development practitioner, Dr. Jayanti Ravi entails myriad realms of experience in her multifaceted career. She holds a master's degree in nuclear physics from the University of Madras, MPA from Harvard University, and a PhD specializing in technology enhanced education, conceptualizing a multivacity from MS University, Baroda. She has authored several books, including Sanity in Sanitation, published by Penguin. She has championed the cause of Swachh Bharat Mission for rural sanitation in the state for 2 consecutive years. Till recently, she was the Principal Secretary of Health and Family Welfare Department, Gujarat, after being Commissioner Health for over 2 years. During her tenure as Principal Secretary, Gujarat's handling response to COVID-19 has been well appreciated and documented. She currently works at Auroville Foundation as a secretary. I'd like to hand over to Dr. Jayanti Ravi to kindly take us through her topic. Yeah. Over to you, ma'am.
Good afternoon. Thank you, Kritika, and good afternoon to everybody. I'm extremely happy that we're all meeting here for something very important. Indeed, WASH matters and matters a lot. And as we all believe, the people who are participating in this today are people who not only have professed it, but practiced it, not only personally, but for all the various public health programs that we've been championing. And this has been very important. At the beginning, I want to share something which happened to me several years ago as I was leading the Swachh Bharat Mission for Gujarat as the Commissioner for Rural Development and the Principal Secretary of the Rural Development Department. We used to go to these villages early in the morning and actually figure out which are the people still where there is resistance to behavior change, people choosing to defecate in the open and sit, talk to them, trigger them, Gandhigiri, all of that was a part of our daily routine back then. Our entire team was used to a different biological clock where we would be up early in the morning, do all of this, come back to office, and again, have all our office work and so on. So I remember at about 6 o'clock in the morning in a village in Idar Taluka of Gujarat called Mesan, if I remember right, we were having this very interesting conversation with an elderly lady who seemed to have no interest in the fact that she had to actually build a toilet in her village. And actually, we were trying to, so my special commissioner was trying to impress upon her the importance of health, hygiene, and so on. And I remember around then, there was a female health worker, as we call them, an FHW, who also came there. So the conversation got on a little wider. And I was very, very impressed and inspired, and it's almost tattooed in my mind. She actually showed us the importance of hand wash to all the people gathered there. It was not only the old woman there, but by then there was a fairly large crowd of young people from the neighborhood who had all come participating in this exercise of triggering. And there's a very interesting and a bit of a funny anecdote also that I'd mentioned in my book. I don't think we'll have the time here, but she used an acronym and called it SUMAN. I'm sure a lot of you are familiar with it. She showed how you apply soap on your hands with sufficient water for lather and how you actually rub your fingers and hands straight, seedha, ulta, both sides, and then the mutti, and then the angutha, nak, ya nakhun, as we say in Hindi, and then you also had the kalai, Suman K. Suman K was what she gave as an acronym, and it's sort of tattooed in my mind. I still remember that lady in her crisp white uniform early in the morning, must have been by then around 6:30, 6:45, who showed this. And I think ever since, every time I would wash my hands, somewhere this image would cross my mind, and I would really try and practice it, making sure that those mandatory 20 seconds are spent in washing your hands properly. And again, on every visit to every school, every possible gathering where there was a possibility of social behavior change, I would make this point. And almost around that time, another person that I met, which made a very big impact on me, was someone called Val Curtis. I'm sure a lot of you have heard about her. Unfortunately, she passed away some time back. She was also a very dear friend who wrote, a special foreword for my book on the Sanity on Sanitation. And she was actually the director at the London School of Tropical Medicine and Health. And she gave a talk, I remember back then in Delhi, on a topic called disgustology. So she was really trying to see how this religious and cultural context of hygiene is ingrained and embedded across cultures, across religions of the globe. She'd really done research on that to show how disgust was something that had certain common denominators across the world. For example, having clean hands. And there were many things, including the word for fecal matter or poop or shit, as we would call it in the language of goo, as we would call it in the language of Swachh Bharat Mission. These were all common objects that evoked disgust in cultures across space and time. And she'd done a lot of research there. And that was a very interesting talk. And again, as we now look back at what is it that this whole WASH program, back then when we had the Swachh Bharat mission initiated across the country, it has shown how hand wash can actually reduce the incidence of diarrhea by about 30%, respiratory infections, particularly among children below the age of 5 by 20%. And therefore, it's absolutely imperative that this is done. And I also want to share something else, that even in the context of COVID-19, which came and literally shook all of us across the planet. This was a pandemic which literally came and hit us right there. It turned all our lives topsy-turvy. And I happened to be the Principal Secretary Health after being in rural development after the Swachh Bharat mission campaign, after it sort of concluded, because Gujarat had technically become open defecation free. And we realized that it was not so much about the brick and mortar building toilets, just as it is for the hygiene programs or wash programs. It's not so much the physical act of washing hands or hygiene, but it's more the man banana part of it, the making up your mind, getting people to have a behavior change, bringing about a transformation in the way they think, the way they understand. And then that then triggers off a whole process of people adopting and adapting this change in a more acceptable manner. Otherwise, if it's just about toilets, it doesn't work. So COVID too, when it first hit us, we didn't have vaccines back then. There was no very clear treatment protocol in the initial months when COVID had just begun to strike our country. I'm talking of the initial months of 2020. But the first Kavach, or so-called vaccination that we had, the acronym we had all put in place was SMS, social distancing, mask, and sanitation, and especially hand wash, sanitation with the soap. So we would often say a 10 rupee soap is far more powerful than many of the other measures you may want to take. And so this, again, there are several studies and they have shown how for every rupee, there is a 4.3 times return that you have in economic terms for if it is invested in water and sanitation. And there is also an estimation that if you really had a robust national hand wash program, which is in place, but if it is also implemented well, India could actually gain something like a whopping $5.6 billion in our GDP, almost a 92-fold return on investment. And again, when we look at the global context, we do find there are still many parts of the world, when we look on wash in healthcare facilities, we've looked at studies by WHO, UNICEF, you see that nearly a quarter of facilities globally do not even have basic water facilities, and which again translates to 700 million plus people don't have access to water when they actually use healthcare facilities. These could be patients, caregivers, frontline workers, and a host of other people coming there in contact. And so the global target is to at least have 80% of the facilities to have basic wash facilities by 2025 and universal access to basic wash services by 2030. The 2025 target is also for the basic wash services. And now when we come to the national context, and we especially look at health programs, because that has been a greater part of my domain. In India, we have a very nice set of programs. And I must say that in my state of Gujarat too, we gave a lot of emphasis to programs like Kaya Kalpa, the National Quality Assurance Standards, NQAS, as we would call it, Lakshay, which is about the labor room accreditation, and also the Swachh Swasth Sarvatra. So all these campaigns, the indicators that you had on hygiene, waste management, infection control, cleanliness, wash infrastructure availability, such as water, soap, toilets, all of these were assessed. And we also had our own internal assessment. So not only by facility level, peer level, but before the external agencies came in, we also put in place a system of a mock or an internal assessment, so which kept the momentum up and ensured that people were sensitive to this and actually gave a lot of importance. Now, if you look at the state where I have worked for a long time, just to give an example, and the importance of how government could really mobilize all of this, and how is it, what could be a strategy for all of us, the government priority and strategy. I felt that when we look at the context of Gujarat, almost 93% of our PHCs have, all these gender segregated toilets. And they also have, if you look at our rural health statistics of 2020, and under Kaya Kalp and Swachh Bharat mission, as I mentioned, we had more than 70% of the assessment of our facilities getting also qualitatively, there's more than the assessment value was also significantly high compared to what it was in the previous year. So not only was the emphasis on getting more and more public health facilities sort of into the rubric of Kaya Kalp and getting them assessed for cleanliness, but also the quality of the outcome in all of these was also given a lot of importance. And now with these initiatives, I'm not saying these are absolutely WASH specific outcomes, but there are also WASH sensitive outcomes. So we found that whether it's indicators like infant mortality rate, maternal mortality rate, and also disease incidence of diarrhea, various global charts, when we have all these parameters which were compared, we found that there was a significant improvement. And I also want to share that when we gave a lot of emphasis on quality, which is also another sine qua non when we talk of hygiene and when we talk really of WASH and all of these, because quality also means basics. And if this is the basic founding or the building block of quality, if this is compromised, everything else in the edifice comes crashing down. So in that context, we probably today lead the country, Gujarat, with the highest number of accreditations under NQUAS, about 205 institutions, and in Lakshya too, the second highest with about 55. So this was a complete attitude of a great deal of emphasis on quality, which is paying reliefs and great dividends that it is giving. The ODF India target, which seemed like a very audacious, a very difficult mission to accomplish when it was first announced from the ramparts of the Red Fort by the Honorable Prime Minister. But when it was really given a push and a lot of efforts went into it, as I said, it was not just about the brick and mortar part. I think the emphasis this time in the WASH program was also about not only building toilets, but all the forward-backward linkages in terms of the behavior change, also ensuring that the entire village gets open defecation-free status, so that it's not again about an incomplete job that again slips back and you again have a set of toilets which are more like shall I say, a crematorium or a burial ground of dead toilets, defunct toilets. So instead, the emphasis was on ODF and the emphasis was on hand wash, making sure that there was a place for people to wash, a lot of training on hygiene. And all of this really led to Gujarat too being one of the forerunners in achieving the ODF milestone, rural Gujarat, by 2017, we were there. And around then, or a few months before that, I had been shifted to the health department. And I must say that I had the special privilege of reaping and harvesting those dividends of all the hard work that our entire team had put into the sanitation program, hand wash, and of course, the open defecation free and campaign. And in this context, there is a ranking that Niti Aayog and the United Nations do of the Sustainable Development Goals. And when we talk of Goal 3, which is about good health and well-being, in the year 1819, Gujarat was at the 17th rank nationally. And so with a series of interventions, which include hygiene and WASH, of course, again, I'm making a difference to say that this was not as if that alone was a factor. There were a series of factors, but I think this too played a very important, a very primary role in it, because it's not only a sensitive WASH, health sensitive indicator, but a health specific indicator too, and the outcome too. So our rank improved the next year, which was 1920 to the 8th rank. And eventually in the year 21-22, Gujarat got the first position nationally in the SDG 3, which is about good health and well-being. So this again showed how important it is not only to realize and decide collectively at the national level, state level, that this is a non-negotiable we are going to go ahead with it for all these reasons. You can have all the deliberations about why it is important, why it should be done. But having done that, I think once there's a strategy in place, there's a focus, single-mindedness, there's regular metrics, follow-ups, and a kind of relentless approach to attaining that goal and making it possible, then we do see that results are definitely, they would automatically follow if the right efforts are put in. And so again, in Gujarat, we, in terms of both the WASH, putting the WASH agenda in the spotlight, government priorities and strategies, which is the theme today, I'm extremely happy this is being done. There were a slew of efforts, both for the ODF campaign, and a lot of this absolutely fits in spot on, even with the WASH campaign, and whether it's about the social behavior change campaign with triggering, whether it's about having different ambassadors using different mobile apps for it, even having movies made on this concept, and of course, reaching out through cultural and other programs to schools, colleges, so that this is ingrained as a part of their curriculum. They understand the scientific importance of this. It's very important. And also in the COVID-19 and the post-COVID scenario too, we can see that how WASH again was a very important factor, which also precipitated, and it also in a way helped people realize the importance of hand wash. And so these COVID healthcare facilities became both, the healthcare facilities were savior spots, but if they did not have the right hand wash facilities, the right precaution, the infection control processes in place, it also became hotspots for the disease to spread. And I think many development partners, because all of these programs, it's not just about the government alone getting involved and moving this, but it's about the entire community coming together, because it's about everybody, every citizen, everyone out there, just as our motto, Ek Kadam Swachhta Ki Or, that kind of thing. Every citizen, every step matters. And there it's important that all other stakeholders, development partners, whether it's like in this case, we've seen that even Unilever and IKEA played a significant part by providing hand wash soaps and hand sanitizers even during the COVID pandemic. And of course, in Gujarat too, we've had development partners like UNICEF, World Bank, Tata Trusts. I see Divyang's name also today. They've all played a very important role in making this happen by actually apportioning various districts. So with globally too, we know that there are many, still a large number of facilities which don't have this. But in India, we are slightly better off in some states and not so better off in other states. But collectively, if we take a resolve and really make ourselves accountable for this, and also show compassion for our sisters and brothers, because this is like a very, very basic birthright for everyone to have sanitation, to have hygiene. And if we can really use all the methods of social behavior change, communication, whether it's triggering, disgust, every method and no method for COVID, post-COVID, I emphatically agree. And if we look at all this evident, I mean, there are so many suffocating numbers and studies that show that WASH matters now more than ever. And it's absolutely important to prioritize this for a resilient health system and for also building resilient communities which have good health and well-being at their center. The Ayushman Bharat program is also about it. And if we don't pay attention to this, which is almost like for want of a shoe nail, the kingdom was lost. So it's important that we don't trivialize hand wash, sanitation, water, sanitation, hygiene, all of these, as it is put so succinctly in the acronym WASH, and really work on it. And just before concluding, I also want us to give a thought to hygiene and sanitation, not just in the physical context. Hygiene is also important for the physical, but for the vital, mental, and for that pure stillness or raised consciousness that again is a birthright of each one of us if we truly aspire for the highest that has to be aspired. So as I sit here in Auroville Foundation as a secretary, I want to, on the 150th birth anniversary of Sri Aurobindo, also end with a little quote of Sri Aurobindo when he says, "When mind is still, truth gets her chance to be heard in the purity of the silence." So I think that inner sanitation is as important as the outer. But for now, as a campaign, I think we should put all our focus and ensure that post-COVID too, we are back on track for the WASH campaign and ensure that there is no child left behind, no person, no citizen, no lady, no man, no one in the life cycle. Every citizen of India is involved in it, and we all march forward towards India becoming truly a place where all these benefits are reaped by virtue of something as simple but as important as WASH. Thank you again to the organizers, Japaigo, USAID-NISHTHA, and Unilever for organizing this and inviting me to share my thoughts. Namaste.
Thank you so much, ma'am, for sharing those really valuable insights. A lot to learn from what has been done in Gujarat. We now have our chief guest with us. Without much further ado, I would like to invite our Honorable Health Minister, Shri T.S. Singh D.O., the Honorable Minister of Health and Family Welfare and Panchayati Raj, Government of Chhattisgarh, to speak a few words on prioritizing WASH in healthcare systems. A very warm welcome to you, sir. Over to you to take us through your address.
Thank you so much. I'm sorry I have been delayed. I was in hospital. One of our family members was there and I couldn't come online in time. So pardon me for that, and thank you, Japaigo, and all the associations, institutions, Kritika ji, Mita ji, and all the others present. I didn't really read up on what one is to say. So I'll take up from what our previous speaker was mentioning. And it is also a very auspicious occasion, the 150th birth anniversary of I am profoundly impacted and affected by some of his writings. I haven't read much, but whatever little I read, it is indeed an honor to be present in a program which commemorates 50th birth anniversary. As far as health is concerned and health services are concerned, I am intellectually, if we can say so, mentally and on the field committed to universal healthcare. And the target which the UN initially had taken for providing health services to all in 1947, those dates have been long, and the country come forward and take up this duty of governance to provide healthcare to all by now 2030. So far, it seems, as far as I have read up, 7 or 8 countries only have been able to incorporate what can be called universal healthcare or universal health coverage. The others are striving to achieve that goal. And in our country, we have provided healthcare through the public services, healthcare support again through first the Pradhan Mantri Bima Yojana, Swasth Bima Yojana, and then lately the Ayushman scheme, where we have a component of insurance which will cover the healthcare for all the citizens. In our state, we have opted for the trust model. The Ayushman scheme, as you would all know, has provisions for 3 options. One is the complete trust model, the other is the hybrid model, the other is the insurance model. We have gone in for the trust model, whereby the entire health services cost would be provided to selected citizens up to certain limits, which is 5 lakhs under the Ayushman scheme. In our state, we have extended this Ayushman coverage, which was limited to about 38 lakh families as per the SECC data, to about 58 lakh families who are covered by the 1 rupee kg rice PDA scheme. So every citizen, every family who has provided the PDS coverage for rice at 1 rupee a kg, their cards are Aadhaar seeded, and we have included them into the 5 lakh limit. The Ayushman insurance scheme covers part of the cost up to about 50,000 rupees. The balance, if citizens require up to 4.5 lakh rupees, is provided by the state government. We have included a lot of the schemes provided by the government of India and other agencies in under one head and called it the Dr. Khubchand Baghel Swasthya Yojana in Chhattisgarh. So our citizens, 58 lakh families, are covered up to that. These 58 lakh families are covered again up to 20 lakh rupees for other expensive ailments, like maybe if you need a heart surgery, if you need a kidney or a liver replacement, bone marrow transplant, Lockyer, which was already there in the other scheme. We've included all under one umbrella. And today we are providing healthcare up to 20 lakh rupees, either in public or private registered institutions, to all citizens, that is 58 lakh families, who are covered under the Rupee 1 rice scheme. The other members of society, a number of them would be government servants. They are covered through that. There are employees who are covered under the employee health scheme, and others who may need healthcare for higher expenses. We have a provision under the Mukhyamantri, the Chief Minister's Special Health Care Program, Vishesh Swasthya Sahayata Yojana. If their case is sanctioned, then even they are eligible to healthcare for up to 20 lakh rupees. So this is the provision where our goal to provide healthcare from public money, and out-of-pocket expenses are reduced to as near as zero as possible. That is the goal we are pursuing, and we would be very happy if we can remove this division between the BPL and the APL and provide healthcare to all without limits. That is our vision, that is our goal. So it is not 50,000, it is not 5 lakhs, it is not 20 lakhs, but we would like to reach a goal where we are providing healthcare to our citizens in public and or preferably public, but if not so, then private institutions. The outflow of money that we have seen over the last 2 years, initially more than 80% of the insurance scheme money was going to private hospitals. And when we were in the hybrid system, we also saw that whatever we agreemented with the insurance companies, 15% of the amount was straight away taken over as administrative costs. So if we had 600 crores made available for healthcare through the state budget, 100 crores would straight away go to the insurance company for their, let us say, administrative expense. And of the 600, only 500 crores, I'm giving an approximate figure just to make my point. Only 500 crores of public money would be available to the public for healthcare. And that is why we opted for the working under, where the entire amount, we don't have an insurance company in between now. We have the state nodal agency. We have and the government of Chhattisgarh is seeing that payments are made again either to public institutions or private institutions, and the ratio, which was 80-20, has come to about 50-50 or 55-45, where a large number of people are now availing of healthcare services through the public care system also. To strengthen the public care system, which is our goal, so to say, we are I feel, in very strong and healthy competition with the private sector. A lot of money goes there. Lot of money goes to the private sector. So the taxpayers' money, if it is rotated through the public system in the option we have undertaken, that money is rotated through public systems to strengthen their either infrastructure or their machines or the drugs they may need, etc., and eventually reach a goal where, like I mentioned earlier, public healthcare is available free of cost to every citizen in our state. What we have as the infrastructure, health infrastructure, the pyramid, which is known to all of us daily, but I am repeating it. At the base, the wide base of the pyramid is our ASHA worker, the health care worker at the village or mohalla level per 250 population. We have, I think, compared to the country, a very large number of mitanins, our ASHA workers we call mitanins. And we have 70,000 ASHA workers. In fact, they are including the urban area, about 72, 73,000. So the others are in the rural, about 70,000, just short of 70,000. And the rest are in the urban areas. So through these ASHA workers, we provide the first point of primary care. The medicine kits that are provided, they even take malaria tests on the spot at the point of service, and medicines for, let us say, fever or a cough and cold, the other smaller level of ailments that could be covered. The primary health care, we are told, is about 70% of the people who go to hospitals need primary care. And another probably 22 to 23% of the people would be needing secondary care. And the tertiary care segment is about 6 to 8% of the people need tertiary care. This is where the maximum amount of money is required. So to provide services for the primary and secondary care, we would like to go through the ASHA workers, the sub-health centers where Madam earlier was speaking about Laksh, etc., for the maternal care, point of delivery nearest your home. If there are interventions required, C-sections required, then you go on up the ladder, healthcare ladder, to either the community health center or the district hospital. So these would be the interventions that we are wanting to have in place. Healthcare, HR is what the public sector lacks in also, apart from infrastructure which has been built up. A lot of money through the NHM and state budget is going into having newer, cleaner, better service providing sub-health centers who have now been labeled as health and wellness centers. We have about 5,300 of them in the state, covering 3 to 5,000 population in tribal or non-tribal areas. And then we have the primary healthcare centers, which is all part of the health structure throughout the country, community health centers. We have now made provision for an MBBS doctor in every PHC. There might be 1 or 2 lacking, but MBBS doctor would be available to citizens in every primary healthcare center. And specialists is where we are having to struggle, from the community health center, district hospitals to the medical colleges. And that is the matrix: the ASHA worker, the sub-health center, the PHC, the CHC, the district hospital, and the medical colleges. Whatever we can provide here in terms of healthcare, medication, we've not run short of budgets for medicines. So that has been my experience as a health minister for the past 3 years. There is no dearth of money apparently for medicines. So we have strengthened the Chhattisgarh Medical Service Corporation and tried to see that medicines are delivered to the last point in time, so that they are there for the people whenever they need it. And expiry medicines also, we have been able to curtail from about 12 to 13 crore expiry medicines annually to about 3 to 4 crore expiry medicines annually. So those are the sort of arrangements we are attempting to make. Making our health in consonance with health care standards, NQAS, Madam also mentioned. So we are also climbing that ladder, and I hope we are able to reach there as soon as possible. COVID has been a very unfortunate experience, but helpful to the extent that it has forced the world and the governments to invest in healthcare, right from making people more aware of their surroundings to cleaner facilities to hand washing. I am about to be 70 years of age now. And in my life pre-COVID, I never washed my hands with soap for more than 3 or 4 seconds, I think. If I'm timing myself, so it has opened the window of that 20 to 40-second hand wash for me. And I used to take our chief medical officer's statement lightly. He used to say, I'm called Baba, so I'm saying, hands, 50% of the diseases they will not catch. So this was pre-COVID. So COVID has not got me down to washing my hands religiously, at least 4 or 5 times in a day with that 20 to 40-second cycle. And I hope it has got across to everybody, every citizen of Chhattisgarh, our country and the world, that a small practice like that, these are age-old practices really, which now come to us. Since children, we've been told, khao, wash your hands before you eat and this and that. But I don't think it hits us to the extent it really should, that the difference that it makes, washing your hands, the difference that it makes in terms of keeping your body healthy, I hope COVID has taught us now. So from our own hands to the healthcare facilities, keeping them clean, leave alone the toilet facilities at either home or in public institutions. This is the path we all need to tread. Ramp up HR, ramp up infrastructure, public health infrastructure and HR must be prioritized so that citizens are not forced to sort of choose an option which is very draining to their pockets. That I think goal we should all aspire to bring to our work areas, our scope of working areas, whether it is a district or a state or the country, as soon as possible. 2030 is too far away. If we are knowing it and allowing our people to be, maybe it's a harsh word, but if we are allowing the system to exploit them financially for so long, knowing that we should not be doing it, then we are not living up to the responsibilities that public representatives or people in the social sector who are aware and who are wanting to bring about a change are being able to achieve it in a short time span. So those are the challenges before us. Nothing is easy, but even in limited budgets, and it's a tough fight, we have to fight against a system which is entrenched, right from the manufacture of drugs to the provision of healthcare services, be it particularly secondary or tertiary. We have to stand up against that and ensure that free of cost, as near free of cost, as near zero out-of-pocket expense is pushed onto the shoulders of our citizens, and we are able to provide them with qualitative healthcare services. There's always this question mark: private hospital is better, government hospital is not as good. That stigma or that sort of situation which has been created over the years, decades, we have to get beyond and ensure that not only make public health facilities provide healthcare free of cost, but to have 3, 4, 5-star public healthcare facilities, providing qualitative healthcare to all our citizens, whether it be our state, whether it be our country, as soon as possible. And with these words, I don't know if I have been very topical, but with these words, I'll end my time. Thank you so much with bearing with me. And thank you so much for having me share my views on the program today.
Thank you so much, sir, for sharing your experiences of Chhattisgarh and also sharing your own personal example and highlighting how important hand washing is now more than ever and why we need to prioritize these hygiene behaviors. So now we've come to the end of our inaugural session, and I'd like to really thank the Honorable Health Minister of Chhattisgarh and Shri T.S. Singh Dio and Dr. Jayanti Ravi ma'am for giving their valuable time for this session and sharing their valuable insights. We will now move ahead to the next session, which is the technical track session 1 on all hands on the deck to build a sustainable wash future. I would like to invite upon Srinivas Honuru from H&K Strategies to kindly moderate the session.
Thank you so much, Kritika. It's a pleasure to be with the heavyweights from the industry, the subject matter experts and think tank. As we actually move on to the technical session, see, we are actually connecting at a time when India is transitioning from the one phase of wash to the second phase of the wash in terms of the kind of mandates that we have till 2030. What it actually entails is how we invest in some of the infrastructure and how we build some of the resilient health systems, and most importantly, involve communities. So I think these are like very relevant and contextual topics, and to make to lend more insights into this, we have put together a kind of heavyweight panel, and it's a privilege for me to actually take time and introduce Pratibha Palji, the Honorable IAS officer from the Municipal Commissioner of Indore City. And then we have Dr. Anuradha Jain, who is the technical advisor for USAID in India. And then we have the representative from the Unilever, Anila Gopal, who will be contemplating on several aspects of how do we go forward, right, in terms of not just investment infrastructure, but how do we make it sustainable and involve more communities. Let me just first welcome Pratibha Palji into the panel. The Pratibha Palji is the first women municipal commissioner of the Indore city, and she's been involving about thick of initiatives around carbon credit, circular economy, air quality improvement initiatives, and sustainable waste reduction measures for the betterment of the city. It's a privilege to have you, madam, when you have been working very tirelessly on some of the indices around municipal performance index, liability index, under Smart City Assessment 2020. The first question, I mean, in fact, we would like to have your insights around, yes, India has invested in infrastructure, fantastic. We have been investing for the last 5 years, 7 years. But most important thing is, where do we move on from here? What should be our priorities so that we ensure that the infrastructure invested is put to use, and then we also improve the sanitation services and uptake?
Thank you. Thank you. I'm Pratibha Pal, Municipal Commissioner Indore. I extend my warm welcome to the dignitaries and participants. It's indeed a pleasure to be part of the WASH event. Swachh Bharat Mission Urban is promoting sanitation and hygiene behaviors with the utmost importance. We recognize basic sanitation and hygiene issues are critical, which is faced by women and adults and girls, affecting their health and well-being, limiting opportunities to pursue education and employment opportunities as well. It has adverse implications for the environment too. I would like to highlight that Swachh Bharat Mission Urban 2.0 speaks of sustained behavioral change, embarking on the newer agendas of sustainable solid waste management and safe disposal of wastewater and reuse. We recognize and promote the gender dimensions of sanitation and hygiene in not only the need for women's participation in planning and implementation of sanitation interventions, but also their leadership in SBM committees and institutions. And this remains as a guiding principle for overall mission execution. We are constantly working towards achieving the objectives of Swachh Bharat mission in Indore. And it's very proud to mention that it's result of our community ownership, guidance from the political leaders, local corporators, our media. We are awarded first rank in Swachh Sarvekshan in last 5 consecutive years. Basically, Swachh Sarvekshan is an annual survey of cleanliness, hygiene, and sanitation on cities and towns all across the country. The success of Indore Swachhata initiative is pillared upon the IMC's very robust initiative, financial models, and based on the convergence with the different government schemes like 15th Finance Commission. Then we have Amrut 2.0, a very important scheme. Then a Smart City Mission, Pradhan Mantri Awas Yojana, Rajiv Gandhi Awas Yojana, etc. If I'm talking about Amrut 2.0, Amrut 2.0 is complying with the mandate of WASH only. It targets to deliver access of clear water for all urban citizens, sewage and septic management, and reuse of water, river rejuvenation, green spaces for urban communities, etc. It has aimed for making cities Atmanirbhar as well as water secure. Then if I'm talking about Indore's example, then CSR support is highly prominent and recurring source of financing support in Indore. We are doing many processing projects in PPP model. We are doing this 550 TPD bio-CNG processing plant in PPP model only. Then we have this automated multi-recovery facility with the PPP partners. Through the initiatives taken in river rejuvenation and rigorous Jan Andolan, Indore has been declared as first water plus city of India, which means there is absolutely no to gray and black water to any water body. That stops groundwater contamination as well, in which public has contributed approx 2 crores from their life savings. They got connected their sewer outfalls from Nala or water body to our sewer network system. We have created an overall healthy and hygienic living environment for the citizens, especially low-income groups living along the banks of water bodies and stormwater drains, nalas, etc. At this juncture, I feel it is very important to address needs and supportive mechanism for our Safai Mitra. And again, it's very proud to mention that out of 6,000 Safai Mitra, we have like 70% female workers with us. Women and girls in the community is also our target group for maintaining and sustaining their health needs. And this call for inter-department convergence with line departments like Health Department, Women and Child Development Department, then National Livelihood Mission, etc., to provide a dignified source of livelihood to women working in the area of sanitation and solid waste management, and overall health and gender benefits through maximizing and optimizing provisions in existing schemes and programs. We have already provided employment to around 1,024 identified informal RAC workers in Swachh Bharat mission only. We have addressed the sanitation needs of various categories of the female population. At present, there are 229 public toilets with around 689 seats in our public toilets and 405 standalone urinals in the city of high footfall areas to cater the needs of working women and travelers. There are 91 community toilets in the city besides 100% individual toilet connections and coverage for safe sanitation practices at home. To cater the needs of female Safai Mitra and working women, toilets of their use are constructed in resident welfare associations as well. We have established a dedicated one-stop solution center that called Safai Mitra Seva Kendra in all 19 administrative zones in the city. These centers provides various resources to the Safai Mitra related to government schemes, low-cost innovative tools, health checkups, assistance in loans, technical trainings, and hands-on field training, etc. We have also encouraged female entrepreneurship through Swachhata Uddami Yojana, with the loan provisions and such innovative technology challenge. This is a startup leading by a women entrepreneur. We have also collaborated with USAID-NISHTHA Zapago towards building a capacity of our Safai Mitras and community women for addressing their emerging sanitation and hygiene needs through learning workshops. One such workshop was organized in December 21, in which a free of cost health checkup camp was also organized. And it was concluded that anemia and few other blood-related deficiencies were prevalent in our female staff. Hence, taking it a step forward, we have organized a detailed medical checkup for them in association with the Government Medical College of Indore. Here, I want to conclude that sanitation is everybody's business, and cross-sectoral, cross-departments, collaboration and alignments will enhance impact of promoting and sustaining wash needs of community with a special focus to the needs of women and adults and girls, and therefore leaving no one behind. My congratulations to the USAID, co-partners NISHTHA and Zapago, and Unilever as a co-partner. Thank you so much. Thank you for giving me the opportunity to speak here. Thank you.
Thank you, Pratibha Paulji. I mean, when we talk about WASH, some of the healthcare services and WASH interventions, India, due to the sheer size and volume, we suffer with inequities. And to stress and lend more light on what needs to be done to address this, we have with us Dr. Anuradha Jain, the technical advisor with USAID in India. Dr. Anuradha Jain is a clinician with formal training in public health. She's been actively participating in the public health interventions for the last a decade and a half. And she's been associated some of the large visible healthcare projects in India, like the Rashtriya Bal Swasthya Karyakram, RBSK and JSSK. Madam, I've been part of one of the public-private implementer for some of those high-level initiatives. It's a pleasure to invite you and request for your perspectives around that the marginalized and vulnerable populations are often left out of some of these WASH interventions or healthcare interventions. I request you to throw light on some of the investments that USAID has made in the WASH, and how do you really ensure that communities are actually part of this, and then the inequities will be addressed, especially among the vulnerable populations.
Thank you so much, Srini, and thank you, the NISHTHA team, for once again giving me this opportunity to speak here. So I'm a big, I have no shame in saying I'm a big fan of Jayanti Ravi ma'am and her work in Gujarat, the way she has dealt with COVID and the rest of the things. I don't know if ma'am is still online or not, but ma'am gave an example of how she was impacted and affected by one of her staff, a frontline staff. Similarly, in my initial career, when I joined public health, as clinician, all of us, we are never taught the importance of hand washing, hygiene, sanitation as quote unquote, practitioners. We know the importance of hand washing, but the way we look at it from a public health perspective is completely different from the way we look at it as a clinician. And when I came into public health, one of my first exposure to why WASH is so important is that I was working with orphan and vulnerable children, and this was in slums of Delhi. So there was an organization that was trying to work on the nutrition status of these OVCs, and they used to provide ration to the families of OVCs who used to then cook food for them and give them so that the nutritional status of these children would improve. However, over a course of 1.5 years, the organization could not see any significant improvement in the status of these children. And I was an independent consultant at that time, and I was called in to look into the matter of why is it happening. And one of the issues that I found was that these children constantly had episodes, severe episodes of diarrhea, and going deep into the matter, what I realized was that these children lived in slums. The water supply was not piped water supply. The potable water was usually stored in plastic cans in their houses. And that's what they were consuming and recurrent. Being OBC children, some were affected, some were affected. So they were on drugs, some were not on drugs, but they had these, regular infection that they undergo. And that's the reason, despite being under medication and getting such good nutrition, their weight wasn't improving. And weight is a very, very important criteria when children are on ART to fight with the disease, because this is your autoimmune system or your immune system that needs to respond to HIV AIDS in these children. That was my first exposure of how important water, hygiene, sanitation, and its relationship with health, and especially urban health, is. The second episode in a similar fashion is when I was doing this complex evaluation as part of a government technical agency. I was visiting, this was a JSY evaluation, I was visiting a lot of facilities. And one of the reasons, one of the questions that we used to ask women was, why don't they want to stay in a facility for a longer period when the JSY mandates them to stay 48 hours? And one of the responses they used to give me, madam, toilet available nahi hai. हमें नहीं toilet, हमें bathroom जाना बहुत problematic होता है. Even in labor room, they didn't have a toilet, and some of the women in some of the facilities in those times, I think this is, I'm talking about 16 years back, had to go out in an open field, which was, outside the labor room to for their toilet purposes. So these were the kind of things that I saw, which made me again realize how important it is, the way health is related, and some of the indicators of our qualities are so closely related to some of these issues in wash and hygiene. And that brings me to this very fact, why investment is so important in this whole sector of health and hygiene, both directly, indirectly, as well as, in terms of human resource that are there. Why do we invest in these three ways in the sector? So USAID as an organization is invested in this whole process of the wash for a very long time, and till now, the statistics that I have available in FY 2020 itself, USAID provided $450 million to 41 countries, $450 million to 41 countries for wash purposes. It's a huge sum. And we mobilized nearly $216 million, which is beyond the taxpayer funding for this particular cause. Not only this, we have helped USAID strengthen 289 water and sanitation institutions. 3.9 million people gained access to sustainable water service, and 68% of those gaining access to it for the first time in their lifetime. 4.1 billion people gained access to sustainable sanitation services, and 90% of those gaining access to it for the first time. So the amount of sheer investment USAID does in this area is enormous. However, within the within the country, which is aiming, as part of the Swachh Bharat Abhiyan, to have 100% sanitation in the country, and it has huge targets that has been set up by the country itself. USAID is trying to work, to support some of these targets in the country, and as part of these, we have done a lot of private sector collaboration, because USAID alone doesn't have that kind of resources. Government alone doesn't have. So the partnership or the convergence that we talk is so important here, and that's where private sector actually comes. Our partnership with Unilever is an example of such kind of convergence that we are talking with the private sector. But beyond that, what USAID has done is we have leveraged, for something known as the water ATMs that we have set up in certain parts of the country. Corporations like Google, Citibank, Gap Inc., Coca-Cola, Cisco, Microsoft, and others who have been helping us to maximize this impact in the country, because the sheer amount of resources that are required for this particular job are so huge that no alone agency can do it. And that's where the importance of people coming together, the partnerships is so much. Some of the other collaboration, as I mentioned, the water ATM, they provide vulnerable, the moderators asked me that question of how do we address equity and how do we reach out to the vulnerable population. So the ideas with which we started these water ATM was that the vulnerable and the underserved population would have access to safe water for 24 hours. And we started it, the seed money came from us, but the CSR contribution took it high. And the actual result was that we were able to establish 350 water ATMs and 1.3 million people were reached. But the actual results were shown of the water kiosks when COVID happened. And at that time, these water kiosks became such an important intervention for risk mitigation for people who were affected or not affected, but were in the containment zones, in these areas. Star Foundation, Newman's Own, Merck Foundation, Pentair Foundation, PepsiCo, all these foundations came and helped us. Not only this, USAID worked with Ministry of Housing and Urban Affairs, the MAUA, for private sector engagement toolkit. So we just don't do models. What we do is we actually create those toolkits, put them on open source, and everybody has access to it, so that whoever wants to engage, even as part of government or non-government, can use these toolkits to get, to work with the private sector. And why I keep addressing the fact that we are connecting with the private sector is because the CSR rule and the investment potential with the private sector, both in terms of finance and other resources, are very high. And it can be leveraged by anyone to use. The other kind of investment that we do is in human resources, as I said earlier. And how we do example of that human resource investment is in the city of Indore. Pratibha ma'am just spoke about it. NISHTHA worked with the Safai Mitras. There's another program that we have, Samagra, that has initiative of reaching the last mile population. By reaching this population, what they're doing is bringing the social entitlement close to this vulnerable population. And one of the subset of the vulnerable population that I'm talking about here are the sanitation workers. So there are nearly 8,000 to 9,000 sanitation workers in Indore who need access to services, and public services are sometimes not available for certain reasons, and thus at that point of time these people need some paperwork to have access to services like those available under PMJ. So Hak Darshak connects the sanitation workers in the 18 wards of Indore to this paperwork, which then enables them to access social entitlements that are being provided by government like PMJ and other TPDS facilities. And these people then are able to take care of their health through the entitlement schemes that are there. So this is another way. NISHTHA again does capacity building of sanitation workers and the Safai Mitra. That's another way of investing into these. Recently, and this is the last example, I know Kritika would want me to end after 6 minutes. So the last example I would give is that we were recently in Pune and we have this work on IHIP going on there. I met an MPW worker who told me that how important it is to do a container index and a household index of the water, because the vector-borne diseases are so much dependent on them. Investing in such MPWs and investing in frontline workers, investing in Mahila Arogya Samitis, the self-help groups who can then be part of such exercise of monitoring their own surveillance system, a community surveillance exercise that can help prevent vector-borne disease in places where water is collected, is also part of wash investment, even though it looks like an IHIP and IDSP investment, a surveillance investment, but it has very, very close relationship to what we do in wash and sanitation. So, Kritika, without taking any more time, I would say that our commitment to investing directly, indirectly, and in human resources for wash and sanitation remains, for the sheer reason these are very interrelated. Health without social determinants is not possible, and social determinants equally are impacted because of poor health. Thank you so much for giving me this opportunity.
Thanks, Dr. Jain, for actually summing it up very appropriately in terms of the need for the kind of intervention. I mean, India is such a country where every state is equivalent to a country in Europe, and the government cannot be, everything for everybody every day. And your stress actually brings to a very important topic of track one is all hands on the deck, and one of the important hand happens to be the private sector. To lend more light on this, we have with us Anila Gopal, who is representing the Unilever. Anila is the Health and Wellbeing Director at Unilever's Global Sustainability Team. Anila oversees the kind of critical public-private partnerships, and also which includes the kind of health and hygiene behavior coalitions formed in response to COVID-19. Anila also brings a significant experience of working with the UNICEF, UNFPA before her stint with Unilever. And Anila is also a master's from Harvard School of Public Health. Welcome, Anila. And one critical question we would like to have your inputs on is, what's the kind of role for private sector in forwarding the kind of agenda, the WASH agenda across the kind of a continuum of healthcare, and also involving the kind of communities. So if you could just please help us with your inputs.
Sure. Thank you very much. And thanks to all the panelists for very interesting, really enjoyed, particularly the speaker just before me, Dr. Anuradha Jain, talking about the importance of social determinants, because all of us in public health, and particularly from India, tend to come at it from a more of a clinical point of view, whereas a lot of public health is actually determined by everyday behaviors. I'm just trying to having some issue with my laptop stability, so I'm just trying to dial in, but I'll just continue on the phone in case this doesn't work. So could I request the team to put, I had some slides to show, could I request the team to put it up, please?
Yes, ma'am, we're just doing that.
Thank you very much. So in the meantime, while the slides are loading, let me just introduce. So I look after health and well-being at Unilever and the global sustainability of Unilever. Some of you might know Unilever, some might not, but many of you would certainly know the brands. Lifebuoy soap, sorry. Are you able to hear me?
Yes, yes, Anilaji, but there's a bit of echo.
Sorry about that. I think it should work now.
Yeah.
So I was just introducing Unilever. You can move to the next slide. So we're a company that makes a lot of products that you'd be familiar with, probably some of them in your households. Lifebuoy, Lux soap, Dove soap, some of the creams like Pond's, soap, Surf, Wheel, etc. What's interesting about Unilever is we've really taken it upon ourselves to become the leaders in sustainable business. This is no longer a good to do or a nice to have. It's something that's ingrained into our business model. And not only would we want to be purpose-led, but we also wanted to deliver financial performance, because that's what our shareholders want. And that is when other companies will also see and adopt sustainability into their business. Next slide, please. So we spent a lot of years thinking about hygiene. Actually, Unilever was founded now spread globally. our responsibility, and certainly in the times we're living now.
Anila?
Sorry to interrupt, Anila. I think you're breaking a little bit.
Yeah, we
There's
are not
some
able
poor connection.
Hello.
Just give us 2 minutes.
Yeah, is this working?
Yes, yes.
Yeah, we can.
Apologies.
Yeah, please,
I will just continue on the phone.
Yeah, sure.
So so this the behavior change programs are all underpinned. These are very simplified schematics that you're seeing on the screen, which is kind of used as a backbone to create the behavior change programs that we work on. So for example, making it understood through demos, making it easy. A lot of you on this call who work on public health would know that just the presence of a hand washing facility, and soap at the right place allows you to then practice the behavior, making it desirable. So this is the reason why we work with a lot of celebrities, a lot of role models, peers, to make the behaviors like hand washing, using a clean, safe toilet aspirational for people. And finally, of course, talking about rewards, which not only refer to, tangible, materialistic rewards, but also things like social recognition. So these are kind of some of the pillars that we've used. It's very much marrying the disciplines of marketing with what we know in terms of public health and communications. Next slide, please. So I thought that the best way to talk about the role of the private sector is really through example. This example I'll talk about today is the partnership that's kept all of our teams the busiest over the last 2 years, which is a large partnership that we have with the UK FCDO, the UK Foreign Department. And this is called HPCC, the Hygiene Behavior Change Coalition. So when the first cases of COVID were coming about, at the end of 2019 and early 2020, we joined forces with the UK government to say, what can we do as a public-private partnership to cope with this? And what ended up stemming from there is this large coalition, of 21 partners in 37 countries. And the idea was very simple. It was to make sure that we're able to deploy at speed behavior change on hygiene through all channels available, through mass media, through on-the-ground programs, etc. Next slide, please. This is just some of the reach that the program was able to achieve. It reached over 1 billion in a span of a year and a half. And even more than that, I think the entire teams who work on this are the most proud of the fact that it's reached some of the world's most vulnerable people in Asia, in Africa, and Latin America. If you're talking about refugees, you're talking about migrant workers, etc. And alongside with the product response of 78 million products such as soap, sanitizer, this was coupled with behavior change programs on the ground through health workers, through schools, through community groups, as and where applicable. Next slide, please. This is an example of a mass media response. So this was truly developed in a collaborative way. This is not Unilever advertising. This is us joining hands with the UK teams and the schools of London School of Hygiene and Tropical Medicine. So this password campaign, which was a simple password to help bring our world back from Corona, is what we had used across. I've given some of the examples of the India creatives. But the idea was, how can we create a campaign that truly serves the purpose of this public-private partnership to promote not just hand washing with soap and keeping your surfaces clean, but also social distancing and wearing a mask. So this is kind of an example of the output. Next slide, please. In terms of advocacy, so H for hand washing is a very interesting idea that we've been trying to use as an advocacy platform for the last few years, which is that When children are taught in school ABC, A for apple, B for ball, C for cat, how is it that we can intrinsically make H associated with hand washing? Because COVID has taught us that this matters not just today, here and now, but to future generations, and integrating that into syllabus and through all channels available. So we worked with Sesame Street, which is one of the world's best, created some of the most loved characters, Muppets, etc. That's very child friendly, to create games, etc. And shared all of these assets with the HBCC coalition. Now, all of this work is possible only because of partnerships. And in this case, it's not a single partner, but it's this entire network of 21 partners. Really delighted to be partnering with USAID and Japaigo. I think this NISHTHA initiative already existed, already talked about WASH to some extent. What we thought we could really add value to this is to further strengthen the WASH component through anything that we have available as learnings in terms of Unilever and HPCC. Next slide, please. These are just some of the examples of how we're working with the Japaigo team and the USAID team. We have several programs. Some are for mothers. So you can see Mum's Magic Hands, which is actually designed for emergency settings such as the pandemic. Mobile Doctorney, which is a phone-based program. The neonatal program, which some of you from USAID may or may not know, is actually co-created with USAID, a targeted program to reach pregnant and new mothers on the ground through health workers. And then talking to school children as well as separate programs. So we're working with the Japaigo team to look at the health and wellness centers, to look at the schools and the community programs they have, and make sure we can insert and integrate the best of the materials we have, because a lot of it is evidence-based and can help drive the objectives of the NISHTHA program. And just to end, should there be any other private sector partners on the call, but even for those from the government and public sector, this is a kind of a summary model. The way we look at it in terms of how can the private sector partner is not every company is a Unilever. You might have another company that specializes in IT or creating some other product, is to look at it across the value chain. I find this a very useful framework to look at it. So, starting with your own operations, your factories, your, farmers who help provide you the raw materials for your products, starting there, looking then at the value chain of your distributors, your customers, and all the lives you touch along the way, in a matter of speaking, are brands that a lot of people know. And we know that a lot of times messages that come from brands carry a lot of value and aspiration as compared to an unbranded message. So how do we leverage that for good? And finally, wider society. So looking at industry coalitions, for example, making the private sector voice heard in all of these big UN processes. For example, we were very active in the creation of the SDG 6 indicator on hand washing. We were very actively lobbying for this with partners. So this is the value chain approach we take. Thank you all. I'll end the presentation here and welcome any questions, of course. Thank you.
Thank you so much, Anila. I think we heard from our panelists, the distinguished panelists, around the need for kind of interministerial cooperation, the kind of convergence between the public sector and the private sector to make actually things happen and go beyond the kind of just WASH infrastructure, involve the kind of communities, which is very, very critical for a kind of sustained WASH behaviors. And the other important key takeaway is that the resources need not be financial alone, right? It's a kind of a combination of financial plus, what we do at the community level to mobilize and uptake of services. With that, we actually conclude the session 1 technical track as we move on to the next track 2. In the interest of time, we're just not opening the panel for any questions, but you can just drop your messages in the chat box so that we will respond after the track 2. Kritika, if you could, I hand over to the colleague Kritika, please to take the session forward.
Thank you so much, Srinivas. Now we come on to the second session, Innovations for Delivering WASH Sustainably and Equitably, Learnings and Reflections. So we have a whole range of partners who have joined us today to share their rich learning experience and on-ground experiences from the field. So without much further ado, I would like to invite our first panelist for the session, Mr. Anuj Sharma, the Chief Executive Officer, Pyramid Swaraj, Anuj Sharma is a development practitioner and a social entrepreneur who believes that a large part of development challenges and disparities are around last mile access to various necessary services, including safe drinking water. He's a Tata Amul Scholar from IRMA, and for the last 16 years has been engaged in designing and scaling up low-cost, high-impact, sustainable solutions for serving the underserved. Under his leadership, Piramal Swarjal is leveraging business know-how, technology, and compassionate talent to deliver safe drinking water for all. Mr. Anuj Sharma, I'd now like to invite you to share your insights on One Water for All, a pathway to water, safe, and secure future. Over to you, sir.
Thank you, Kritika. I hope I am audible. Okay. Good evening, everyone. And first of all, thanks to the organizers, the moderator, and to every panelist here for the insightful discussion. Now, I would try and stick to the time limit, and B, the topic given to say, what are some of the lessons and reflections as to where are we headed? But before that, I found this theme very interesting. The One Water and Water Secure Future. What do we even mean by one water is one question that it sort of threw up at me. And before I get into the resource that we call water and the different dimensions of how our life sort of interacts with it, I would just like to bring to the gathering once again to all the people in audience, the centrality of water to our life. We all know that it has become cliched to say, oh, water is life and Jal Hi Jeevan Hai and all sorts of things we've all grown up listening to. But honestly, when you look at, in the current context also, and, for last 1.5 hours, what we've been listening to and sort of deliberating upon, we find the different sort of dimensions coming out here. We are all familiar of the health burden that contaminated drinking water can pose, right? Dr. Anuradha Jain spoke about it. And by the way, Dr. Anuradha, thank you for bringing up water ATMs. I mean, Surgel's first claim to fame was to create that and sort of get it patent and all of that. But this has come a long way from there. I guess the industry has really taken the idea over. So the point I'm trying to make here is we are all familiar with the waterborne disease health burden, yeah, especially for the under 5 children. But what is the second other element? I think in India, we are all familiar with the situation where we had schools, but the learning outcomes were not being delivered. We have primary health centers and the services at the last mile because of the availability of doctors, the trained staff, and for multiple other reasons like tough terrain and the connectivity, etc. So the service delivery becomes a challenge. And when SBM happened and the toilets happened, one of the key questions which sort of the country and especially everybody who practiced wash was wondering, saying, where is the running water? And thankfully now we have a Jal Jeevan mission which is trying to address that part. But that's another sort of dimension to say, even for us to really gain from our work in SBM, so the gains on the hygiene side, gains on the sanitation side are crucially linked to the water availability. Other than that, we are all familiar with, especially the times that we are in, the April, May, June period, at least the newspapers pay some attention to the water scarcity, water shortage issues and the news related to it. So the crop failures and the agri challenges are, the another dimension when we think of water. And it's surely related to the rural prosperity or poverty, the way you want to look at it, because ultimately it's a big livelihood provider, agriculture in this country. The more gender specificity is another thing that I want to underline. Who goes to fetch water, right? Typically, we all have this impression from rural India saying these are young girls and their mothers who will be walking whatever path needs to be walked to fetch water for the daily needs of the family, right? I remember, although slightly dated, is that now, I guess, about 40% of Indian rural women have to walk anywhere between 500 meter to 2000 meter, which is, half a kilometer to 2 kilometers daily to fetch water for their family. Now, that's an average, by the way. Please keep that in mind. And that's saying 40%. That's a big number. Hopefully, Jal Jeevan Mission will address it with functional household tap connection. Another dimension I want to bring out is it's not the drudgery alone, the effort of going and fetching it. This also leads to the child missing out the school, especially the girl child, right? So it has that dimension also. Now, honestly, the SBM gains are one part, but there's definitely dignity element connected to it. So the water availability sort of can make that difference of yes and no here. And lastly, I would speak about in the post-COVID sense, I think at least 2 to 3 speakers before me have already spoken about the hygiene side of it. And by the way, speaking of ATM, I would like to just mention quickly that during the, the pandemic time, and especially around the first lockdown and in large parts of Delhi slums and Bhubaneswar, where our teams deliver water through water ATM, what we could do was over the air, we could actually change the type of software. So instead of touching a button, it requiring a push of a button to say, I need 5 liter or 10 liter for the day's requirement, you could actually do it without touch. Now, even those sort of, technical advancements or the innovations are, they happen when the life challenges us in the form of, things like pandemic. So these were the multiple dimensions that I sort of quickly captured to say, what is it that we are dealing with when we talk about one water, and how the water safe future would mean what gains, or if we don't sort of achieve that, then what could be lost, right? So there is that downside to it. Now, water as one resource, where are we today? And, trying to take a sort of countrywide position and keep it simple to sort of deal with conceptually. There are largely spoken of 3 different usage of water, right? There are family or the household level usage. There are farm, which is the agriculture related usage, and there are then factory related usage. When you look at these 3, the relative usage, you would find farms account for almost 80% of these, right? So the food security is directly related to it, but this also goes into cash crop, etc. Why is this important for us to understand? Because I think the question really being asked is, what is the pathway to water secure future? So I think we need to recognizing where can we reduce, where can we reuse, where can we replenish, those kind of principles. Where do you apply if you don't know the relative, proportions where water gets used, and how one could apply something like, say, you need to create agri efficiency to just reduce the water. So that's one pathway, right? Water being used in agriculture. But on the other hand, are we actually, reclaiming water or reusing the gray water or the wastewater that's coming out of the households? And thanks to JJM now, much more of that is going to happen, and we need to have a plan to handle it. I'm told saying SBM does have a subcomponent. I'm not sure how far that has been acted upon. And the third one, I would say, the water conservation under the Jal Shakti Abhiyan and otherwise, at different stages in the country, people have tried and mobilized this. And this is some traditional knowledge that we should be proud of. But I think there is still not, like someone was saying, sanitation is everybody's business. I guess the water conservation is also going to be everybody's business. And so that's another piece of our traditional knowledge that we need to sort of tap back into and bring it to the center. Now, having spoken about, the dimension in which sort of, water is central to our life, the multiple dimensions, and how the water as one resource is being utilized, and where all one could sort of make a difference for future to be water secure. So what are some of the possibilities that we need to work upon or think of when we are together as health and sanitation and hygiene and water fraternity are deliberating here? When you look back towards, let's say, education and health, you would find that there's a teacher in case of education. There is a Anganwadi worker, Rasha worker, A&M. That's the last mile worker or the frontline workers you have in these spaces. But, I would also almost claim that the public health engineering departments in various states, which is sort of responsible for delivering Jal Jeevan Mission also, I think the one critical piece we are going to be needing is creating a cadre to take care of maintenance operations, because today we don't have it, right? You have pipe and pipe is leaking and the water is being wasted. I think that one is going to be super critical, both for SBM and for Jal Jeevan, right? Similarly, I think there are new technologies, the GIS mapping, or even what Surjal has now taken its ATM technology to pipe water being monitored remotely, so that you again know where the water is reaching, where it is not reaching, and how it can be sort of the services can be made more reliable. So that's another element where I think focus needs to go. And lastly, I would like to say, and hope I'm keeping it well within the time. Lastly, I would like to say all of this, I think, cannot be achieved if we continue to look at the rural communities or urban slums. So the communities, if we look at them as just the means to implement the programs, that's not going to happen. The grassroots governance really needs to be strengthened and bringing people together. And that's where I think the larger scale behavior change campaigns also, to say whether it is about water conservation, whether it is really about water quality and people really knowing the, what's the right drinking quality versus people knowing the right hygiene practices. I think all of that needs a lot of attention, but it's not limited to only doing the behavior change campaign. I think ultimately the community has to be looked at as the partners in the change. And, unless the grassroots governance of these things gets improved, I really feel saying all the other enablers will not be able to deliver to their optimal potential. So I think with that note, I would hand it over back to you, Kritika. Thank you.
Thank you. Thank you so much for sharing these valuable insights and bringing in so many dimensions of, water, wherein how, the gains on hygiene and health are very crucially interlinked to water availability. And what you said last was very true, like, on how we need to take communities as partners and take them along with us. So thank you so much. Now we will go ahead to our next speaker, Mr. Binu Arakal. Mr. Binu Arakal is the head of strategic initiatives at WaterAid India, and he's built strategies for scaling up WASH interventions across WaterAid's India program. Mr. Binu is also responsible for development of various advocacy strategies and also has led advocacy campaigns which involved on WASH and which involved a lot of convergence, on WASH interventions. So I'd like to invite Mr. Binu to share his learnings on strengthening sustainable sanitation programming. Over to you, sir.
Thank you, Kritika. Am I audible? Okay.
Yes.
Thank you. Thank you so much. And first of all, I would like to congratulate USAID-NISHTHA, Japaigo, and Unilever for this initiative. And this is a most appropriate time, I would say, to have a deliberation on such a relevant and such an important issue on linking WASH with health and looking at WASH in a more broader perspective. There's no doubt that there has been a lot of work that has happened across the country in terms of sanitation. So let us just try and understand what has happened, over the last 4 or 5 years, and where we have succeeded, where we have, where there are some shortcomings. I mean, often what we end up doing in panel discussions is that we claim a lot of success in terms of the way sanitation program has, succeeded in the country. No doubt there has been a big push in this entire sector. 2014 was probably a watershed moment, not just for the nation, but across the world in terms of making a dent on, the sanitation challenge that the world was facing. There has been an investment of more than 100,000 crores in terms of sanitation, just in terms of the pure incentives that were given for toilet constructions. More than 10 crore toilets were constructed, and it was expected that it might have reached around 60 crore people. So this by no means is a small achievement. Definitely that's a huge achievement. It has caused a huge dent in the sanitation situation across the world, in the country and across the world as well, because bulk of the sanitation challenge was in India, right? If you look at some of the studies that some of the agencies have done, like UNICEF had done a study in 2018, which says that an estimated 300,000 diarrheal deaths could be reduced if the country becomes open defecation free. Likewise, BMGF did a study in 2017, which says that there is an impact of, there's a very clear impact on stunting as well as wasting in terms of nutrition. So likewise, UNICEF again did another study in 2017, which says that if there is an ODF village, it is estimated that every household would be able to save something around like 50,000 rupees per year purely on health expenditure that they would have otherwise incurred. But the catch here is that it talks, all these studies talks about open defecation free communities, which means every household having toilets, every individual in the household using the toilets at all times, and no open defecation seen across, anywhere in the area. But is it really, is it really correct to say that we have become open defecation free? I mean, my recent experience in traveling in 5 states have seen there are areas where there is huge slippages, and slippages may be because of many reasons. I'm not going to get into all the details of it, but what we are observing in the field is that there are issues around quality of construction for sure. There are issues around the whole involvement of community. The first speaker, the madam, has said that, there was a very, I would say it was a very nice way of taking forward the entire sanitation campaign, how you trigger communities, how you get the people, oriented, not just oriented, but get the people start thinking about the issue of sanitation, and then start working on the on construction of toilets. But the moment it was linked with, huge targets, the moment it was linked with, outpacing the other districts in becoming open defecation free, somewhere we, may have lost track in some places. I'm not saying that the entire country has gone that way, but there would be a lot of places where, it may have lost track. So that is something that really needs to be looked into. Availability of water, again, is a critical issue. I mean, I've been to Rajasthan recently, which is really, facing a lot of issues in terms of availability of water, and to expect that people will start using a pour flush toilet in places where you don't have enough water to drink is a little bit, difficult. So that is another challenge. Then there is also this whole issue about one size fits all kind of toilets which have been constructed across. So in a rocky terrain, you are seeing pit latrines. Obviously, it cannot be used. It will not function in those places. But in the rush for constructing toilets, in the rush for making villages open defecation free, there has been some, missteps along the way. That is something that we maybe have, we will have to go back and look at it. Unfortunately, what is happening right now in the sector, be it government, be it NGOs, be it funding agencies, everybody has stopped looking at the, first generation challenges of sanitation, and they have kind of moved to the second generation challenges where they're talking about grey water management, about, fecal sludge management and all that. But it is important to understand that sanitation is it's a behavior change program that we are talking about. And behavior change cannot happen on a target-based approach. It cannot happen on a very, tight timelines or 3-4 years target, and you change the entire behavior of people. It takes time, So you have to really go back, look at what has happened. Where are we as far as the open defecation free status is concerned? There are around, I think, 200,000, I don't remember, 6.5 lakh Swachhagrahis across the country who had participated in the sanitation campaign in between 2014 and 2019. Right now, they are nowhere to be seen in the entire sanitation, work that is happening across the country. So how do we engage those volunteers? How do we engage those people and the community to look at, the sanitation situation and see how do we really address the first generation challenges as well? The first generation challenges have not ended as of now. So the whole approach of community-led sanitation, which has been adopted in Swachh Bharat mission to an extent, needs to be relooked at, needs to be worked upon more intensively now. So that is something that we really need to look at it. I would say that though there has been slippages, I would not say that everything is lost. There has been a tremendous uptake in terms of the whole messaging around sanitation. There has been a lot of people, a lot of effort that has gone in creating awareness on sanitation. There are cities, Pratibha Pal madam was here. So Indore has been #1 city in terms of sanitation for quite some time. I think 4 or 5 times it has become #1 city. If you go to Indore, you can see how people are now becoming very conscious, and they are looking at sanitation as a matter of pride. So it's not that the kind of efforts that have gone into this entire scheme has gone waste, but there is a need to look back and keep track of where we are losing track and work on those aspects. It's not just about retrofitting toilets, which the SBM has been talking about. It's not just about retrofitting. It's also about changing behavior. It has not happened completely, right? We need to continuously, hit those messages. We need to continuously target those communities and take the sanitation message again and again with these communities. Otherwise, the whole gain that we have achieved due to the sanitation campaign in the last 5 years would be lost very soon. So that is something that we really need to look at it. I would just conclude by one of the things that Mr. Anuj just mentioned about the whole issue of grey water management. I would actually take it one step forward and not to look at just grey water, but to look at liquid waste management as a whole. Because it doesn't serve any purpose if you have toilets in the village which has septic tanks and the drainage and the overflow of the septic tank is drained into the open areas or into the drains. So it's as good as open defecation situation in a village. So we really need to look at sanitation as a comprehensive way. It's not just toilet construction. It's not just grey water management or solid waste management looked in silos. It has to be looked in a comprehensive way. Then only we'll be able to really get the benefits of the sanitation campaign. That's it. Thank you, Kritika, for inviting me for this event. I'm so sorry I could not really have more discussions with you before the session because I was traveling, and even now I'm traveling. So sorry about that. Yeah. Thank you.
Thank you so much, Mr. Binu, for really taking out some time, even in spite of the fact that you were traveling. And thank you for taking us through the various aspects of the various challenges, and how we need to look at sanitation more comprehensively rather than just building toilets. So moving on, we have our last speaker for today, and she's going to be talking about one of the most important topics, I would say. So I'd like to invite Ms. Manvita Barati, Director, Urban Management Center, Gujarat. Ms. Manvita is a founder and director of Urban Management Center for almost 3 decades. She has been one of India's leading voices advocating for the development of better cities. She's among the first in India to work towards professionalizing urban management and has been a strong advocate in reforming and decentralizing urban development and strengthening people's participation in governance. I'd like to now invite her to kindly talk about, to take us through the gender perspectives for building women entrepreneurs in the war space.
Sure. Thanks, Kritika, and thanks, Meeta, for persistently contacting me to come on the session. Being a last speaker, I'm sure everybody would be tired, but I'll try and make my presentation short and also pointed, as you might expect. Thanks, USAID-NISHTHA and JAPICO for this opportunity. I have a few slides. Let me try and share this myself, and if there is a problem, I'll request the organizers to help me share this. But I guess you kindly confirm if you can see my slides.
Yes, ma'am, we can.
Okay, wonderful. Okay, so I'll be talking about how do you work with
Could you just
sanitation?
Make it,
Yes, I will. Yeah. So I'll be talking about how to work with women entrepreneurs and what has been our experience in trying to get them to take up that space as entrepreneurs. And as you know, they're the most vulnerable ones working in the sanitation space. One, you're a sanitation worker, and you're also probably a woman, so that is a double whammy, we would say. So we try to work with creating SHG groups of women in the urban areas. In rural area, it's more and more established, but in urban area, it's relatively nascent. We are embedded with the DLM, the National Urban Livelihoods Mission, and that gives us an opportunity to look at far and wide, countrywide, to see what has worked. So as you know, there are about 6.9, about 7 lakh total SHGs who are working in the country. They're like collectivized. Now, as part of our work as bringing convergence between sanitation and livelihoods, we brought out convergence guidelines in 2018. It was released by the then secretary and the minister. And it basically gives us a framework for convergence, because we strongly believe that as a country post Swachh Bharat mission, we have created a lot of infrastructure, but we haven't looked at where are the people behind it, who is going to maintain, where is the money coming from, and how it's going to be maintained. And that brought us to work with the ministry on how women groups can be engaged, because in any case they are working, but they are not organized. They aren't looking at it as a livelihood option. So we started our work with formation of SHG groups of the sanitation workers, and the emphasis was when the cities and states are asked to form sanitation of the SHG groups, at least 10% of the SHGs formed should be of sanitation workers. So identification, listing of sanitation workers, waste pickers, and transgender communities who would want to work in this space was a huge task which was undertaken. And then to facilitate them to for entitlements and bank linkages. So how can we engage sanitation workers in sanitation enterprises? If you see the full sanitation value chain, at each aspect, like the first, when you say there is creation of HHHL, awareness generation was done by sanitation workers, SHG groups, mobilization of toilet applications, because these are nuts and bolts to make it a success. Go to households, get them the application. They were trained to do that. Or whether it's construction of individual household latrines or toilets, one would say, or monitoring whether that's been happening, the construction is going as per schedule, and how to get bank loans or create internal lending mechanisms. So these were the works, or I would say responsibilities, which were taken over by SHG groups in the sanitation value chain. If you look at these are the examples which has really worked very well in Warangal. Women came together as the SHG group and started construction themselves. Of course, there was a training module, etc., which was taken up. The bank, the linkages were also undertaken with leveraging the credit to them as and when required. If you see in the sanitation value chain, when it comes to the public toilet or community toilet construction, operation and maintenance become a large challenge. SHG groups took up this challenge, and they were involved in the operation and maintenance. They're also involved in assessment of community public toilets and identification of mobilization of needs for sanitation of community toilets, and also construction and monitoring of this community toilets. Some of the examples which are handled by sanitation workers are in Warangal, in the various places where we worked in Odisha, in Sambalpur, or in Denkanal. We have very good examples of how groups have come together and are maintaining the public toilets and the complexes. If you see whether it's desludging, it has been a very male-dominated space, but these SHG groups have come forward to create and take employment opportunities. Have been also driving this desludging vehicles, go and emptying these vehicles and sending it to the right appropriate places, whether it's STP or FSTPs. So sanitation worker SHG groups have been trained as not only survey of septic tanks, but also undertake scheduled desludging. And one can see these examples in whether it's Vasai Virar in Maharashtra or in in places like Sinnar in Maharashtra. There are many examples now, such as these. If you see later in the treatment segment, the women have been involved in operation and maintenance of fecal sludge treatment plants, and there are about 100 odd treatment plants now functional between Odisha and Andhra and Warangal and Telangana. And they are involved in running these plants or selling the dry compost or sludge after getting dried, and undertaking landscape work, and give tremendous experience on looking at how women groups are organized and working for these. If you look at IEC campaigns or awareness generation in the solid waste management, I spoke about sanitation as in community toilets, individual toilets, treatment facilities. If you come to solid waste management, SHG groups have again contributed tremendously, whether it's a campaign or household segregation of waste. And you've seen examples in many cities that women groups have come forward to do house-to-house collection of waste, who have also communicated the need for segregation of waste as well, or mobilizing waste collection systems at slum level, because city governments sometimes are biased, or I would say are not paying enough attention to the slum level segregation processes, but they would encourage SHG groups to come forward and do it. The service provision, whether to the door-to-door collection and transportation, has also been taken up by some of these women groups. Of course, monitoring of these services, whether it's effective use of PPEs, or check whether no open garbage dumps are created. And this was very much seen during the Swachh Sarvekshan times. A lot of vulnerable points were operated or were monitored by women groups. So these are examples of, in Odisha, statewide campaign of creating a cadre of Swachh Sathis has been taken up, and women groups, as you can see in the pictures, with its segregation of waste, distribution of the buckets, and making them understand what needs to be done, which is communication, and also as a electric vehicle driver, as women have taken up. And this is an ongoing program of the Housing and Urban Development Department of the Odisha. Women groups have also been trained to do this rangoli, or I would say even route mapping. How would that vehicle be going house to house, and their understanding of their bastis and communities and the city comes forward. This much trust has been put by the city government. They are paid workers, I would like to emphasize, and it has been mandated at the Urban Development Department level. Similarly, in Maharashtra also, you do see such examples emerging, and whether it's Bhadravati or Bhandara in Maharashtra, they have been given these vehicles, and women have taken these initiatives. There are some stories, and I with positive time, I will not go, whether it's Lili or Subhadra in Denkanal. They have not only learned how to do driving, but are diligently working towards collection of solid waste management. If you look at in the sanitation value chain, when it comes to processing of waste, women groups have also been involved in home composting and communicating how home composting can be done. You can see these examples from Telangana, because a statewide program has been launched by the state there. So trainings have been conducted over 48 ULBs, and women groups have taken initiative on going house to house, community by community, and explaining how home composting can be done. It's a huge area of work, and women have really contributed far and wide. Now, what can enable this? One, I would say a strong leadership at the I'm ending.
Yeah, thank you.
Yeah. How can this be done? The state level involvement is necessary, and the state governments have to really take up these aspects. And these are examples of in Odisha, whether it's MCC or MRF, statewide program has been created to have 7,000 plus SHG members participating in partnership with the Odisha program. So I would just like to end by saying that these actually sanitation worker SHG groups have contributed back to the state government coffers by selling these compost and done wonders to Odisha government's campaign as well. So thank you very much. I hope this has been useful. Thank you.
Thank you so much, ma'am, for really sharing that rich experience of involving SHG groups and the amount of work that they've done, and it's really great to see all this. So now we've come to the end of our session, and I would like to hand it over to Ms. Meeta Jarwar, the Senior Wash Specialist of NISHTHA. Over to you, Meeta ji, to kindly share the closing remarks and vote of thanks.
Thank you, Kritika. In this segment of the event, it is important for us to comprehend the learnings as a key takeaway from wide spectrum of experience, thoughts, and vision presented by our esteemed panelists. This would be a guiding factor for all of us to plan and strengthen WASH intervention. Firstly, there's a need to focus on management, mobilization, and governance among partners. In all national flagship program of water sanitation and hygiene, multi-stakeholder coalitions, platforms contribute towards strengthening accountability and transparency. For implementing strategies better, the contributing partner remains local government, private sector, civil society, and household. Therefore, higher level of participation is a key to community programs where local group carry preset of activities with defined objectivity and in a time-bound manner. Secondly, sustainable behavior change is required for sustainable health. It's time for adoption, continued practice, and sustenance of positive WASH behavior, with the realization that improved knowledge and awareness alone often does not result in behavior change. The need of the hour is to build from the systematic effort, successful practice from expert player in the field of social and behavior change. And we are fortunate that government programs, USAID, WASH strategy, Unilever focus, indicate and prioritize social and behavior change. Next, keep gender on the map. Interestingly, all field-tested solutions put focus on hygiene promotion and have a strong gender perspective. Women do play a great role in influencing and adoption of key WASH behavior, not for themselves, but for their families and community. They are self-motivators. Therefore, there's a need of a gender transformative program, keeping women in the center and at the same time promoting male engagement for enabling and supporting environment. Further to this, promoting hygiene through health system for improved outcome need to be an integral part of health system strengthening program. Poor WASH is a main cause of fecal transmitted infection, including cholera and diarrhea disease. Poor WASH is strongly associated with malaria and neglected tropical disease. Safe WASH in healthcare facility is critical to maternal and newborn health. The prevention and control infection disease through improved WASH practices significantly reduce the burden from public health system. Therefore, in all forward-looking healthcare programs, there's need to have well-defined, result-oriented WASH strategy. With these learnings and commitment for us to promote healthy and hygiene behavior further, I would like to thank our most valued leaders, experts. It is our privilege to have you with us today. We extend our gratitude to Honorable Minister of Health, Family Welfare and Panchayati Raj, Government of Chhattisgarh, Shri T.S. Devji. Sir, under your leadership, you are working in Chhattisgarh with our health and hygiene intervention. We are honored to have Dr. S. Jayanti Ravi. Ma'am, you are one of the building block of health and hygiene programs. It was great to have Ms. Pratibha Pal, Municipal Corporation of Indore City. Ma'am, it was your confidence on us that we had opportunity to collaborate for Safai Mitra in Indore through learning workshops. Dr. Anuradha Jain, From USAID, Ms. Anila Gopal from Unilever. Ma'am, it was very motivating to have you, and thank you for supporting us all through. We extend our acknowledgement to Sri Anuj Sharma for Piramal Sarvajal, Binu from WaterAid, Manvita from Urban Management Center, Gujarat, for sharing field-tested evidence-based model, which has contributed to the sectoral learnings. We would like to thank Kritika and Srinivas for moderating the event, and most importantly, thanking all the participants for taking out their time from their busy schedule, especially our state, district teams, community health officer, frontlines partner, as our extended team to take this learning further. A big thank you to all of you for making it happen, and have a great evening ahead. With this, we conclude the event. Thank you.